8:30 now, and it is time for our 8:30 High Beam Talk with the Doc, which is brought to you by Mako's Pharmacy at 240 East 3rd Street in downtown Yorksville. Mako's, your local pharmacy with a caring and knowledgeable staff which is focused on your health and wellness. And as always, Dr. Tim McKnight joins us, looking good from your week away, but very good. We appreciate you.
It always is a recharge on the battery.
Yeah.
Have a little time away.
Maybe we should talk about that sometime.
That's probably a good topic.
Because I think that's a mental thing as well as physical.
Oh, absolutely, yeah.
But today we're back to the physical, and knees in particular, I guess, and joints are troublesome. Knees bear a lot of weight, so I think that's where they sometimes start to give us some trouble.
I think probably most of your listeners over the age of 50 can probably identify with that.
Cracking
aching knees. Sometimes for some of us they hurt more than others, but some people have knee pain every day, and they struggle because the first thing you'll do is reach for some type of a pain reliever, a Tylenol or an anti-inflammatory like Aleve or Advil. Sometimes those work great, but if you escalate the dose or use too much, it can be hard on your kidneys, it can be hard on your liver, hard on your stomach, can raise your blood pressure. So it's not always maybe the best option when we're talking about knee pain. And most of the time, for most of us, it's an inflammatory problem, and it's chronic inflammation. It's one thing to strain your knee and have pain because you twisted wrong, you did something, but it's another one to just have that gradual chronic inflammatory pain that makes you wonder, how am I going to manage this in the future? And so we have to understand that inflammation is a healing process, acute inflammation. You injure something, there's an inflammatory process that helps you heal. But chronic inflammation is actually detrimental to tissue, and it breaks tissue down, and it's something we want to avoid. And often that's just repetitive trauma. Maybe we have improper mechanics. Maybe it's an old high school injury from cheerleading or football that the ligaments haven't been corrected, and there's abnormal movement in the knee joint, and there's more tissue breakdown. But chronic inflammation is bad. It causes continual destruction. And in our knees, we have cartilage that pads the thigh bone with the shin bone, the cartilage that sometimes tears. And that's there to give us an extra cushion and to protect the knee from being bone on bone. But that can break down over time. There's another part of the knee that
doesn't it wear out kind of with age?
It does.
Too?
It wears thin, and for some people, it wears a lot faster. I've got patients that are early 50s who have had double knee replacements, and then I have patients in their 90s that don't even have knee pain. So that seems to be probably some type of a genetic predisposition. But there's another area of the knee where there's cartilage, and that is the undersurface of the kneecap. So the kneecap, when you bend your knee and straighten it, it slides in a groove in your thigh bone, your femur. And that cartilage that sort of protects that bone on bone can break down over time as well. And that can cause that achy knee pain when you're sitting for long periods of time.
So when you're taking the over-the-counter pain reliever, that's really just deadening the nerve endings, but it's not doing anything with the cartilage.
Well, that's true. It doesn't help the cartilage. When you're taking Tylenol just tells your brain to ignore the pain. It doesn't really do much for the source of the site of the pain. But the Advil, Aleve, ibuprofen, that does cut down on some of the inflammation in the joint, and it can give you good relief. I personally do much better with ibuprofen than I do with Tylenol. Tylenol doesn't do much of anything.
Is that acetaminophen?
Acetaminophen, right. But I guess the point I'm trying to make is there's a lot of different options for things that you can take and do for knee pain. And one of the listeners asked me about a product called Zyflamend, which is advertised as a herbal inflammatory supplement that can help with knee pain. And these are really good questions because you see these things advertised and you wonder, should I get this? Well, it's really interesting to me because these supplements and products that we use for arthritis pain They do have some physiological basis. The people that make these understand this inflammatory process. So what's anti-inflammatory that's safe? Well, antioxidants are anti-inflammatory that's safe. And one of the best antioxidants that I've recommended for years is turmeric. And fish oil is another good one. So this particular product, if you look at the ingredient list, it has turmeric in it. It has fish oil in it. And then it has a bunch of other herbs and different type of supplements. It has astaxanthin, which is a rare plant nutrient that has powerful antioxidant action. Well, that makes sense. Elderberry, which is a powerful immune supporting agent. And then it lists 67 other ingredients. There's a lot of different anti-inflammatories. 67 others. So you can imagine, and these are very small amounts, obviously, because you're taking a tablet, right? But when you start adding all these in, the cost goes up. But the problem, again, or the challenge with these over-the-counter supplements is it's not FDA regulated. We haven't done double-blind placebo-controlled studies to know if they're effective. So people say, well, boy, this looks good. Well, that's marketing. And when you see turmeric, well, I know turmeric's good. Maybe I should get that. Or fish oil, I know that's good. I should get that. So those kind of words will lure you into thinking I need to buy this.
And those don't have to be tested because they're natural substances. Is that true?
That's right. Yes. And again, the FDA doesn't regulate it, doesn't mandate it like they do with prescription pharmaceuticals. So what my advice for patients is, well, try it. You tell me. It may work. I think these products, the good quality products like this one is probably a decent quality based on what's in it, is try it, buy a bottle, take it for a month. If you feel relief during that time or you have more pain when you stop it, then it's probably doing something for you. But the more important point is to understand chronic inflammation. We can make inflammation worse by a couple things. We can make inflammation worse if you've got, you're losing that cartilage and you're just jumping and you're running and you're doing a lot of pounding on that joint. You can make it worse. So what's the best thing for that? Well, try to move in an anti-gravity situation like a swimming pool. Swimming pools are great for that type of arthritis pain. Or maybe instead of jogging on sidewalk, maybe jog on a track, or better yet, get on a bicycle where you're not pounding the knee joint.
Or find some grass, but that's a little more difficult.
Yeah. So those are some of the things that people can think about, but it's understanding what causes that to break down further. And the one that we overlook or that we want to ignore is weight. You add 20, 30 extra pounds or 50 pounds on a knee joint, or 100 pounds, you can imagine the inflammation impact on that. And it's not just the weight of the body, it's the inflammation that people carry when they gain excess fat. I mean, your whole body becomes more inflamed, so joints will hurt more. And then the other really important one that we overlook, we want to buy a supplement to take care of this, is our diet. I mean, this supplement's talking about turmeric. It's talking about these plant anti-inflammatory antioxidants. It's talking about fish oil. Why don't we just get those in our diet? And the opposite of, so that's a plant-based diet. But the opposite of that is, and I tell people because I've done this, I'm kind of an expert in this, is go really bad with your diet. There are anti-inflammatory foods and there are inflammatory foods. Omega-6 fatty acids are inflammatory. That's your vegetable oils. Those are what are in most of your cooking products. Go real high in sugar for a day. I told my class once, I tested this. I did an experiment on myself. Not because I was doing the experiment, because I wanted brownies one day. And brownies are full of sugar, and the vegetable oil that you add was a cup of vegetable oil. And as I'm dumping this in the mix, I thought, boy, this is inflammatory. This is really bad. But my emotion said, who cares? You want those brownies. You're going to like those. So I made the brownies. And not only did I have one 2x2 square, but I had 3 or 4 because I couldn't stop, or I wouldn't stop. And the next day, every joint in my body that had a little inflammation in it was on fire. I mean, my shoulder, my knee, my back. And it just reminds us that when we eat the wrong foods, we're going to have more inflammation. If you're not sure if you've got arthritis in a certain joint, try that experiment. You'll know exactly where those joints are, and then say, okay, that now I just proved something that I shouldn't do. I'm going to hurt more. So let's go with healthy foods. Let's go with trying to get some of this weight off. The other thing that I tell people when they have especially knee pain or hip pain is knee pain in particular, if you can stretch the back of the knee, in other words, extend your knee straight out and pull your toe back, that stretches the calf and the hamstring. Sometimes stretching the back of the knee, I'm not sure the mechanism, will really help knee pain. So that's one thing. The second thing that I found goes back to when Coach Hartzell was here and we did the band therapy. If you can open up the knee joint, that can, for some people, that can relieve that pain. So you have somebody, you sit down on a chair and maybe have somebody gently pull on your leg as it's straightened out. And you're not going to feel that joint open up, but just a pretty hard tug and a tiny bend in the knee as you try to relax it and straighten it, that will open the knee joint up and that'll help. I just had a friend the other day who sprained his ankle terrible at the gym. It was swollen. It was black and blue in the bottom of the foot. He was in pain. Thought he might have a broken ankle. I said, let me check it. He was in a lot of pain. 15 minutes with the band therapy, he stood up and he said, the pain is gone. And that's what we did. We did traction therapy. We did compression. And we moved some of that inflammation out of the joint. And we opened the joint up. And it felt better. Now, the next day was still a little bit stiff, but it was 90% better than it was before we started. He was very skeptical when I started, and he's now a believer, telling everybody about it. So,
and untreated, that would have been a week or so. Recovery,
that would have been
easily,
probably 4 weeks before it really felt better. So that's another technique that you can use for knee pain, is just trying to open that up, and that requires bands or somebody that knows how to do it. But there's so many things that you can do when you have knee pain before you go to getting the knee injected with cortisone or Hyalgan or one of those other substances that gives you sort of the lubricating fluid back in the knee joint. And then, of course, the last thing is a knee replacement.
Yeah.
But just remember, this is chronic inflammation is bad. How do we get rid of chronic inflammation? How do we stop the repeated microtrauma on the knee? So those are the things that I think are really key for us.
All right. Hey, we appreciate it. And I won't tell you that we had brownies for Father's Day.
Well, let me ask you about your pain here when we go off the air.
Yesterday, wow. Yeah. All right, thanks. That's Dr. Tim McKnight. As always, we appreciate the advice and learning something here this morning as we talk with the doc. Brought to you by Mako's Pharmacy.